High-functioning anxiety. Definition, symptoms, signs, and more. High-functioning anxiety is a term some people use to describe themselves, despite not showing typical signs of anxiety. They might excel in work, sports, or other areas, but still face challenges. People with high-functioning anxiety experience common symptoms like excessive worry, overthinking, and poor sleep. Effective treatment options are available for all types of anxiety. Doctors don't recognize high-functioning anxiety as a distinct condition, and there's limited research in this area. However, some people manage to function well despite having anxiety symptoms. Anxiety disorders exist on a spectrum and affect individuals differently. Some experience moderate to severe symptoms, while others may have mild distress or impairment. Those who consider themselves high-functioning may have mild impairment or subclinical anxiety, where they don't meet the diagnostic criteria but still experience symptoms. Subclinical anxiety symptoms can be mild, atypical, hidden, or brief but recurrent. People with high-functioning anxiety might hide their symptoms and appear calm and confident. Internally, they may feel scared, worried, or have obsessive thoughts. They might overthink, struggle to relax, and experience disrupted sleep or appetite. These symptoms can have significant, long-term impacts on health and relationships. The causes of high-functioning anxiety are not well understood due to limited research. Anxiety disorders likely result from a combination of factors, including genetics, personality traits, exposure to stress, health issues, and substance use. People with a family history of anxiety or childhood shyness are more at risk. Stress or trauma can also trigger anxiety, as can underlying health issues or substance misuse. Without enough research, it's unclear exactly how high-functioning anxiety manifests. Anecdotal reports suggest fewer obvious symptoms that still allow for functioning. Possible signs include worry, fear, irritability, perfectionism, overachieving, fear of failure, overthinking, and physical symptoms like elevated heart rate and sleep problems. There may also be a link between high-functioning anxiety and depression. The National Alliance for Mental Illness notes that 60% of people with anxiety also experience depression. Chronic anxiety and stress can increase the risk of depression, yet only 36.9% of those with anxiety disorders receive treatment. High-functioning individuals may be less likely to seek help. Many only seek treatment when they struggle to cope, or when they recognize their symptoms as problematic. Some view traits like perfectionism positively, despite the underlying anxiety. Chronic anxiety can harm self-esteem and mental health, contributing to depression. Doctors can't diagnose high-functioning anxiety, but it may be a level on the anxiety spectrum. To diagnose recognized anxiety disorders, doctors might first rule out underlying medical conditions. If none are found, a mental health professional can assess and treat the anxiety. Diagnosing anxiety in high-functioning individuals can be challenging, as their impairment is not always obvious. It's crucial to provide doctors with a complete picture of life and feelings. Primary treatments for anxiety include psychotherapy and medications. Many people need a combination of both to improve. Psychotherapy, like cognitive behavioral therapy, CBT, is effective for managing anxiety. CBT helps reduce anxious thoughts and confront anxiety-triggering situations. Therapists can also teach techniques like deep breathing, meditation, and progressive muscle relaxation. These methods benefit those with high-functioning anxiety. Several medications can treat anxiety, including antidepressants, buspirone, and benzodiazepines. Finding the right medication and dosage may take time. Individuals should contact their doctor if they regularly experience distressing anxiety, can't control symptoms, or if anxiety affects their relationships, health, or self-esteem. Using substances to manage symptoms or developing other mental health issues like depression are also reasons to seek help. Early intervention leads to better outcomes. Doctors don't recognize high-functioning anxiety as a specific condition, but anxiety exists on a spectrum. Some people may present as high-functioning, with no obvious symptoms. Despite appearing fine, those with high-functioning anxiety face significant challenges. Treatment can help manage symptoms and improve well-being. Anyone who thinks they have anxiety should discuss treatment options with their doctor. Early help is crucial for managing symptoms effectively,